deadliest surgery ever, also known as the only surgery in history to have a 300% mortality rate. Also, it's not a surgery of a woman pregnant with twins. It was 18th century. Liston, like many other surgeons, proceeded in his usual lightning, quick and bloody way. He was so focused on his speed during the amputation that he accidentally cut off the fingers of his assistant along with the patient's leg. And when he swung the knife back up, the spectator fainted on the spot. It was later revealed that the spectator had died of shock, and the patient and the assistant soon died as well after their wounds got infected. The theory that made Liston's surgery the only one on record with a 300% mortality rate. But he was the fastest surgeon of his time. He was so fast that he could amputate a leg in under 30 seconds. Also remember, at that time, these surgeries were performed without anesthesia. So 30 seconds will be full of pain and agony and blood loss. So the fastest, the better. The longer the wound is open, the higher the chances of infections, because there were no antibiotics, no sterile operating rooms. So by this criteria, he was one of the best surgeons of his time. Normally, he had a 90% survival rate and washed his tools, hands and gowns between surgeries. He also operated on anyone who asked him to, regardless of their status. He is also credited as the man who first pioneered the use of ether to render a patient unconscious before surgery, sparing them the pain while awake, which inevitably led to the invention of anesthesia. This was a man who wanted to do his best to minimize the pain and death of the people he was trying to help. It is very sad that a single bad day has more or less cemented his legacy as a quack. On an end note, it's also unlikely that it ever had happened, as the story is originally sourced from some of his rivals. There are no primary sources that are available that suggest this happened. Liston died of an aneurysm on December 7, 1847, so we will never know.